Hello, my name is Dr. Javier Calcines, and on behalf of my co-authors, I will be presenting our case titled Two Twists in One Admission, Unusual Sequential Sigmoid and Cecal Volvulus in an Elderly Patient, a case of therapeutic complexity. Colonic volvulus is an important but uncommon cause of large bowel obstruction. The most frequent forms are sigmoid volvulus, which is more common in elderly and institutionalized patients, and second volvulus, which is usually seen in younger adults. Sequential presentation of both types in the same admission is exceedingly rare and possesses diagnosis as well as therapeutic challenges, especially in frail patients with multiple comorbidities. We present the case of an 88-year-old woman with a history of COPD, squamous cell carcinoma of the dome, and breast cancer, who was admitted after a mechanical fall resulting in a non-operative tibial fracture. On hospital day 3, she developed progressive abdominal distension and obstipation. Imaging revealed a type 3 hiatal hernia with severe fecal loading, and subsequently CT scan of the abdomen confirmed sigmoid volvulus. She was initially managed conservatively with bowel rest, nasogastric decompression, and intravenous fluids. Given her frailty, surgery was deferred, and gastroenterology performed endoscopic decompression with successful detorsion at 40 centimeters. Symptoms improved and her diet was advanced. However, within 48 hours, she developed recurrent distension, nausea, and inability to pass stool or flatus. Examination revealed a tympanic, distended abdomen with absent bowel sounds. Repeat imaging now demonstrate marked cecal dilation consistent with cecal volvulus. At this point, given her worsening status, she underwent emergent exploratory laparotomy with right hemicolectomy. Her postoperative course included antibiotics, parenteral nutrition, and supportive care. She recovered favorably and was discharged in a stable condition. This case illustrates an unusual sequential occurrence of sigmoid and cecal volvulus in one admission. While sigmoid volvulus often responds to endoscopic decompression, recurrent rates are high without surgical fixation or resection. Cecal volvulus, in contrast, rarely respond to non-operative management and usually requires surgical resection. In elderly patients, risk factors such as redundant colon, chronic dysmotility, prior laxative use, and comorbidities must be all considered. Management decisions must carefully balance the high perioperative risk with the life-threatening potential of untreated volvulus. In summary, sequential sigmoid and cecal volvulus is rare but should be suspected in elderly patients with recurrent obstructive symptoms after initial decompression. Early recognition, close post-procedure monitoring, and timely surgical escalation are critical to achieving good outcomes. A multidisciplinary and individualized approach remains the cornerstone of care of this vulnerable population. Thank you very much for your attention.